Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Now we'll know completely about the fluoroquinolones, the important points. So fluoroquinolones. So what are they? So these fluoroquinolones, first we need to know what is the mechanism of action of the fluoroquinolones. So the fluoroquinolones, it inhibits the bacterial DNA. So inhibits the bacterial DNA gyrase. So it inhibits bacterial DNA gyrase. So this is nothing but the topoisomerase. So it inhibits the bacterial DNA gyrase, that is a topoisomerase 2. Then it is also bactericidal, so the bactericidal drug. So let's look at the drugs and its uses. So as we know, they are classified into 4 generations. So what happens in the first generation? The first generation, the drugs are mainly include the norfloxacin. The norfloxacin is used in the treatment of the UTI. That's the first generation. Then the ciprofloxacin. So ciprofloxacin is another first generation drug. So ciprofloxacin is used in case of mass chemoprophylaxis. So mass, it involves a mass, that is a mass chemoprophylaxis in case of meningococcal meningitis, that is MM. And it is also used for the treatment of traveler's diarrhea. So it is used in case of traveler's diarrhea and also the typhoid and the typhoid carriers. So ciprofloxacin used in case of mass chemoprophylaxis, that is for meningococcal meningitis. It is used for treatment of traveler's diarrhea and the typhoid carriers. So this is the drug of choice. And ofloxacin. Then moving on to ofloxacin. Ofloxacin is used in case of treatment of the leprosy. So in leprosy it is used, and also it can be used. Ofloxacin is used in case of the TB and also the diarrhea. Now moving on to the second generation. So first generation we saw norfloxacin, ofloxacin and the ciprofloxacin. Now second generation, the important drug is the levofloxacin. So what is the use of this levofloxacin? Levofloxacin, the second generation, is used for the respiratory infections. So respiratory infection is where the levofloxacin is used, also in case of TB. Now moving on to the third generation. So what is included in the third generation? There is the gatifloxacin and the sparfloxacin. Sparfloxacin and the gatifloxacin. So gatifloxacin, what is the use of this gatifloxacin? The gatifloxacin is mainly used as eye drops for the eye infections. Revising back, the second generation it was levofloxacin used for the respiratory infection TB. In third generation, gatifloxacin, eye drops for eye infections. Now moving on to the fourth generation. The fourth generation there is a trovafloxacin. The trovafloxacin, and then comes the moxifloxacin. So trovafloxacin, moxifloxacin. Moxifloxacin, the main use is it is used in case of the respiratory infections, and it can also be used in case of TB. It can be used in leprosy. It can be used in intra-abdominal infections. Then moving on to moxifloxacin and the trovafloxacin. The trovafloxacin. So what is special here? There it is very safe to use. It is safe to use in case of the renal failure patients. Next we move on to the adverse effects. So in terms of adverse effects, what is the use? In adverse effects, it can lead to the fluoroquinolones. It can lead to allergies. It can lead to HJS, that is Stevens-Johnson syndrome. Next, it can also lead to the tendinitis. It can lead to the tendon rupture in the elderly patients. Next, it can also lead to the cartilage damage. To learn and grow daily like this, please do subscribe.